Hi for everybody, welcome to Dharyaveda. In this video today we are going to discuss about the drug called Vasa. Not only the botanical description and the rasa panchaka, rogagnata, karma and all, also how we can adopt it in our practice, as it is a wide prescribed and wide applicable medicine, and what are the recent researches carried out over the Vasa. All about these practical things we will get to know in this video. So let's get started. Firstly, what is the basonym of the Vasa? Vasayati sthapayati shariram prakrutau vaste achadayati va. What is the basonym? Why it is called as Vasa? Vasa is the one which restores the health. Shariram prakrutau. Sthapayati shariram prakrutau. If anything, Vikruti is nothing but the roga. Vikruti is nothing but the disease which brings back the prakruta avastha. The one healthy status which brings back the healthy status in the body is nothing but the Vasa. That's why Vaste achadayati, why it brings back the healthiness, prakruta avastha in the body, one which protects the body, is called as the Vasa. So next, what is the botanical name? Adhatoda vasica is the botanical name, belongs to the family Acanthaceae, and vernacular names and why, how it is and how it is called in regionally. In Kannada, we'll call it as Adusoge. In English, Malabar nut, and in Hindi, Adosa will call as. And what are the synonyms and why and all those synonyms are called to Vasa is based on morphology, Vajiva, Simhasya, Simhika, and based on the property and action, Ataruksha, Raktapitta Prasadhani, Bishak, Mata, Vrusha, Kafaha, Kasanotpatanaha. So why it is called as Vajiva? Ashwadhanta iva Shweta Pushpanya Asyaha. It is possessing the flowers like like that of the horse teeth. How the horse teeth will be white in color. Vaji is nothing but the horse, and Danta is the teeth. So one which possesses the teeth, white teeth is Vaji. Like that, the flowers is also resembles the teeth of the Vaji. That's why it is called as Vaji Danta. And Simhasya Vidharita Mukha Sadrusham Pushpamasyaha. How the flower of this Vasa is there as like that of the wide opened mouth of the Simha. That's why it is called as a Simhasya. And Simhika also. Simhasya Vat Pushpani Va. Because the flower resembles the wide opened mouth of the Simha, like resembles the mouth of the lion. That's why it is called as a Simhasya and Simhika. And based on the property and action, Atarusha. Why it is called as Atarusha is commonly used in examination. They will, instead of giving Vasa, they'll usually give us Atarusha, write about Atarusha and all. So why it is called as Atarusha? Atan Gachato Rogan Roshati Hinasti. It kills Rogan Roshati Hinasti. By its highly potent nature, it kills all the disorders, many kind of the disorders it is indicated. That's why it is called as Atarusha. Raktapitta Prasadhini. Raktapittam Prasadhayati Shamayati iti. Because it is usually choice of a drug in case of a Urdhvaga Raktapitta. So it is called Raktapitta Prasadini as it has a Shita Virya and Tikta Rasa. It is a Pitta Shamaka, as Rakta and Pitta having Ashraya Ashri Bhava. So it elevates the Rakta Pitta. That's why it is called as Raktapitta Prasadini. Bishak, it is called as a Bishak. Aneka Vyadhinam Sadakaha, which cures many of the disorder, wide range of a disorder. That's why it is called as a Bishak. Mata, Mateva Hitakarini, Roghinam Bishajascha. Vasa, case like a mother, elevates many kind of a disorder, protects the body, protects the sharira against many kind of a disorder, and take care of the body as like that of the mother. That's why it is called as Mata. Then Vrusha. Varshati Madhupushpanam Prabhuta Matutvat, as it has the large quantity, the flowers of the Vasa having the large quantity of nectar. That's why it is called as Vrusha. Kafaha Kafam Hanti iti. It acts as an expectorant and it does the mucolytic action. That's why it is called as a Kafaha. So it is indicated in most of the upper respiratory disorder. It is a choice of a drug in case of a tuberculosis, in case of asthma, in case of bronchiolitis, many kind of the not only many kind, almost all the upper respiratory tract, lower respiratory tract disorders. That's why it is called as kafaha and kasanotpatanaha. Kasanashakaha, kasanotpatanaha, kasanashakaha, as it reduces the kasa. It is choice of a drug in case of a kasa. That's why it is called as kasanotpataha. Kasanotpataha nothing but the utpatana, the one which elevates, one which removes out of the body, the one which subsides the kasa or does the cure of a kasa is nothing but a kasanotpatana. That's why it is called as kasanotpatana, nothing but the vasa. Next comes morphology. How it looks like, what is the swarupa, how it is whether it is a tree or what it is a gulma, that is shrub. Then stem, how the stem is herbaceous above, woody below. The below stem, the stem which is at the proximal to the earth will be the woody, which is thick in consistency and hard in consistency, and herbaceous above, which is green color as it grows above. And the leaves, type of a leaf are simple and arrangement is opposite. Inflorescence is raceme, terminal spike inflorescence having the white flowers. And habitat, where and all it grows, where and all the Vasa is available for us. Throughout the India, Vasa is available. So useful part is usually leaves in Ayurveda will use most of the medicines and formulations is based on the leaves only, whereas in Unani kind of a medicine they'll use even the stem and stem is kind of a abortifacient. What we can say is it has a property of abortion induction property by inducing the contraction in the uterine muscles. And phytochemicals, what and all the phytochemicals the Vasa is possessing and how they are useful in case of many kind of disorders. Let's study the phytochemicals in detail, because when we sit in a clinic, when we do the practice, main importantly phytochemicals, based on the action we can use many kind of a disorder. So what are the main phytochemicals this possessing? Vasa is possessing vasicine, vasicinon, kaempherol, beta-sitosterol, adhathodin, vasculinone, anisolin. So what vasicine, vasicinon, vasculinone are the very highly potent anti-inflammatory, antimicrobial property they are possessing. And these all the adhathodin and almost all main component is nothing but the vasicine, vasicinon, vasculinone. These are having the wide range of properties such as antimicrobial, antispasmodic, and antitubercular, and hepatoprotective, anti-cancerous, and anti-helminthic, then hepatoprotective as I told. And all these helps in various kind of diseases as we further study. So firstly, then comes Rasa Panchaka. First, Rasa Panchaka. What and all the Rasa Panchaka is there? Rasa is tikta kashaya rasa, Ruksha and Laguguna, Vipaka is Katu, Virya is Shita, Doshagnata is Kapha Pitta Shamaka, as it having tikta kashaya rasa, Ruksha and Laguguna, Katu Vipaka, whereas Katu Vipaka and Shita Virya, and Kapha Pitta Shamaka, mainly Pitta Shamaka. So what are karma and rogagnata according to our Ayurveda? Shwaasahara, Shwasa, Kaasahara indicated in Kaasa, Raktapittahara indicated in Raktapitta, Jwaraghna indicated in Jwara, Pramehagna indicated in Prameha, Kamalahara indicated in Kamala, Kushtaghna indicated in Kushta. So why it is Shwaasahara? As it has a mucolytic property. Vasa has the mucolytic property, expectorant property. So it is indicated in a Kaasa. Shwasa and Kaasa as well as, and it provides the bronchodilator. It clears off the bronchioles. That's why it is used as a Kaasahara and Shwaasahara. And almost all the indication of Vasa is only for, not only for wide rangely we have for upper respiratory tract infection, like for example tuberculosis, asthma, bronchiolitis, bronchitis, then cough, cold, rhinitis, influenza, then almost all these kind of a disorder. And Raktapittahara. How it is Raktapittahara? As we have studied, it has a Shita Virya and Tikta Rasa, and it Like for example, it stops the bleeding. It stops the bleeding, and very quick action when and the effective action for a Raktapitta is there, as it is a Shita Virya and Tikta Rasa. Especially it is indicated in Urdhvaga Raktapitta, as Tikta Rasa is indicated there. Jwaraghna, as it has a Tikta Rasa, and pyretic property is also there in Vasa, that's why it is Jwaraghna. Pramehagna, as a Vasa is the hypoglycemic, has a hypoglycemic action. So it considerably it decreases the amount of glucose in the blood, in the diabetic patient's blood stream. So it controls the diabetes and acts as a pramehagna. Nothing but it's a hypoglycemic, very good hypoglycemic agent. Then Kamalahara. So that's jaundice and all. Why it is Kamalahara and how it is Kamalahara? It has a cholagogue activity, that it increases the active action over the bilirubin and increases the excretion of bilirubin, and protects or activates the bile pigments and bile salts, and helps for excretion of a bilirubin, and how it cures the Kamala. And also it is a another kind of action is like anti-ulcerative. The anti-ulcerative property is there in Vasa, so it is indicated in a Kushtaghna. Any kind of a cyst, any kind of a acne, and or whatever the itching sensation is there, or any kind of urticarial rashes due to the immunodeficiency or compressed person. At that time, the Vasa acts as a Raktapitta Prashamana, so it elevates the Rakta. Doshita Rakta only causes acne and vulgaris and all, and cyst and all are when comes to the Pitta, those will happen because of a Pitta, and it has a antimicrobial and anti-inflammatory and the anti-helminthic property. So it is indicated in acne and vulgaris. If your patient complaining of acne, or day-to-day life, we will also have the acne and all due to the tension, stress and all. So what should we do? We need to take a leaf of Vasa. However, we can chew it. It will be very tikta rasatmaka. Easily we can't even consume it, even with sugar and all we can't consume it, but we can dilute it, or else we can consume, we can tolerate that much of tiktata, no worries. So we can consume it. Then the rakta shuddhi will occur, rakta shodhana will occur. By that it elevates the acne vulgaris or occurrence of acne vulgaris, and also it increases the immunity, so that it's gonna give a good immune system, so that nobody will get the allergic reaction and all. Like how the Vasa has a wide range of applicability, many of there, and we will talk in the next slides. And then Amaika Prayoga. How and all we can administer this in Vasa in a kind of a patient, whether in as a wide range of applications, a wide range of a prescription for Kasa, Shwasa and upper respiratory tract infections. What we can do is, we should cold infusion, nothing but the Fanta, Himakalpana. Cold infusion, Himakalpana can be prepared by the Vasa leaf, or else Swarasa we can give, Kvata we can give by adding Madhu or Sharkara to the, if it is a Kafaja Kasa, where the mucus is be plugged in the oral cavity, which is making the heaviness of a chest region and difficulty for breathing, and repeated cough will be there, the sputum will be there on coughing. So at that time we can give it with the Swarasa by mixing the Madhu, as it acts as a Madhu also acts as a mucolytic, and it protects the mucus layer of the oral cavity, so oropharynx. That's why it widely indicate we should give it with the Madhu, or else we can give it with the Sharkara also. And Raktapitta, Jwara, Kamala, Kvata or Swarasa with Madhu or Sharkara we can give. When it comes to the Kushta, such as acne or itching sensation or whatever may be, so at that time we can give a churna, we can prepare, and we can tell to the patient to take in a hot water. By mixing with the hot water, he or she can consume by adding the palatable measures, like it will be very thick tata will be this, so we as per the patient's need we can add madhu or we can add sharkara. When it comes for the acne, we don't prescribe much of the sugar, because one of the cause for acne is also sugar, where the overnutrition will be there. So if we prescribe our medicines with the sugar only, then maybe that extent effect may not occur. They may have the boils of 1 or 2 again. So what we can do, we should minimize use of our sugar. So we can say them as a use with the madhu, as it does the ksharana property and kaphahara properties. The almost all the mukha vikaras or acne and mukhagata vikara are kapha predominant only, as they occur in a urdhva amasha, upper clavicular part, where the kapha is predominant. So we can give a less sugar, or also we can give it with the madhu and all, or whatever the jaggery can be added. And next comes the matra. So how we all see now how we can give. So how we can give, in what quantity we can give, as the Vasa is a highly potent drug. If we given more than the rogi bala or roga bala, then it will definitely causes a diarrhea or a diarrhea. Also, one of the action of a Vasa is it is indicated in a diarrhea and dysentery, which helps for a stambhana. Which helps for a stambhana of a diarrhea and dysentery. Also, I forgot to say that Kamalahara, or else it has a hepatoprotective activity. The vasicine or vasicine or any of the phytochemicals which is present in the Vasa is a has the hepatoprotective activity. That what it protects, from which disease it protects? Hepatocarcinoma. Hepatocarcinoma is the it's a leading cause. Now anyone can see that they will have a hepatomegaly, they will have the liver cirrhosis due to the alcohol consumption, high alcohol consumption, or many of the patients we don't know, there will be no history of alcohol consumption. Even then they have a hepatomegaly, even then they have a cirrhotic degenerative changes in the liver. How it occurs, why it occurs? Because of the consumption of, it is because of the consumption of aflatoxin B1, the toxin named as aflatoxin B1. How we will consume it in a, it is formed by the or produced by the fungus such as Aspergillus flavus, Aspergillus parasiticus. They are the secondary metabolite by the these fungus. How we won't usually, we can say that we won't consume any fungus, we will consume the highly pure food and all. How it comes to our inside our body, how it enters our food chain? It is by the peanuts and the groundnuts, where they will have aspergillus nodules in their root. By that, if they are contaminated, then only. I'm not saying that by consuming these, definitely we will get the hepatotoxic, that is aflatoxin B1. No, not such as it. The high chances of a contaminated food, we don't know, right, how it is the food is, right, what it by which bacteria or by which fungus, by which pathogen it is contaminated. Well, by externally we are seeing that it's very good, very nice to look, then it is healthy. Not like that. It may have a minutest contamination by the many kind of aflatoxins, B1, B2, B3, many are there. Mainly aflatoxin B1, peanuts and fermented foods. Fermented foods, it is if it is contaminated by the fungus, then it produces the secondary metabolite, that is nothing but the aflatoxin B1, which acts as the hepatocarcinogenic and also causes immune weakness, reproductive problems and the malnutrition in the body. By hepatocarcinogenic activity, it causes the hepatomegaly or a cirrhotic changes in the liver, and by the immune weakness and malnutrition, it may cause the respiratory tract disorders as and when the immunity is compromised, as and when the immunity is lowered. Then the first disorder, first infection of human beings suffer from are the upper respiratory tract disorders. So regular consumption of the 1 tablespoon of churna or 15 to 20 ml of a swarasa, regular consumption will bring the detoxification of a liver. That too in such an extent that it completely removes the aflatoxins or hepatocarcinogenic the stimulatory factors, and it increases the immune system, and it provides the nutrition, and it also corrects the reproductive health related problems which are caused by the general weakness, as it provides the detoxifies the body. So as it has a detoxification agents or detoxifying factors in it, we can give it for all raktagata vikaras, tvachagata vikaras, all allergic conditions and itching sensation especially, and acne or urticarial rashes, shita pitta, like allergic cough, allergic bronchitis, we can prescribe. And this Vasa has the considerable rate of a reaction, that is considerable rate of a curability or recovery rate when we prescribe in a acute condition, or also it has a very considerable activity in a chronic conditions also. But in a chronic conditions, not only Vasa can help it, along with Vasa we should have some more kind of a multidimensional prescription, then Vasa will act in a very good manner. Next comes Amayika Prayoga over. Next comes the Matra. In which quantity it can be prescribed as far as 5 to 15 ml if the patient is weak, if the Rogi Bala is less but Roga Bala is strong, in a such as chronic condition where we need to prescribe 15 to 20 ml of Swarasa, then we can dilute it with the water and we can administer for a patient. When it comes to the Churna, 1 to 3 gram, 1 to 3 gram is very difficult to take because the Vasa is a very lightweight. Vasa Patra is very light. When we do the Churna, it will be dry. So dry weight will be 1 to 3 gram is like heavy for consumption. So we can do it in a divided dose. We can add it with the hot water, or we can add it with the milk, or we can mix it with the madhu and sharkara guda if palatability is more important, as it is a tikta, one of the agra tikta dravya. So 1 to 3 gram in a divided dose we can administer in many kind of a situation like kushta, kandu, like raktapitta, for the immune booster as a daily consumption, and for a rakta shodhanartha we can prescribe. Or kvata, it is very easy to consume because in a 20 to 40 ml in a single sip a person can engulf it. So 20 to 40 ml we can give kvata by adding any kind of for example, Vasa is also having digestifying activity. It acts as a digestant. So what we can do, it is a digestant. It relieves the tikta. It is a tikta rasatmaka. Then it is then must be a amapachaka. So how it can act as a amapachaka? So how we should prescribe kvata of a Vasa? Just take a 15 to 20 ml, not in a much quantity. Just add a Jwaraghna in it. When we are preparing a kvata like churna, like 20 ml of kvata is needed. So 1 teaspoon of churna we will add. For that 4 teaspoon or 1 cup of water we will add. And for that while boiling or while preparing that kvata, we need to pound a Jwaraghna. And we need to pound it not in a very fine form like Yavakuta churna, like coarsely powdered Jwaraghna we can add, we can boil, and we can filter it, we can consume it. Acts as a amapachaka, it acts as a Raktapittahara, it acts as a Kushtaghna, it acts as a Jwaraghna, it acts as a immunobooster, or it acts as a digestifier. By that, once the amapachana occurred in the body, almost all the disorders is going to disappear in the body. As the Ayurveda main aim of a treatment is the Agni only. Correcting the Agni by ama digestion is nothing but the complete treatment always. Then Vishishta Yoga. So what and all the prescription we can write? We came to know that Vasa has this property, that property, how it acts, why it acts, and how, when and how we can take. But we don't know what to give or in which formulation. So presently nobody is so free that to prepare Swarasa or to prepare Kvata. So we have standard formulation. What we can write as a prescription are Vasarishta, Vasagruta, Vasakvata, Vasaguduchadi Kashaya, Vasakanda, Vasavaleha. Vasarishta is mainly Kasashvasa, and Vasavaleha is for tuberculosis, Raja Yakshma and Kasa. Vasakanda is for Raktapitta and Shwasa, also for the Kushta. Rakta Shodhanartha we can give. Along with the Vasakanda, we can give for a Haridrakanda also if it is allergic and associated with a itching sensation. And Vasaguduchadi Kashaya for a Jwaraghna, very best, and Kamala also. Vasakvata for any kind. Vasa Gruta mainly for the Rakta Pitta. Gruta is the Pitta Shamaka and Vasa is also Pitta Shamaka. It acts as a multiple action or a high range of action. So we can give a Vasa Gruta there.